Protests recently broke out in Hong Kong over a controversial extradition law bill that may undermine the personal safety and freedom of a lot of Hong Kong people. A million Hong Kong people took to the street to voice out their opposition to such a bill. But the chief executive, on the very same day, announced that the bill would continue its legislative process. Frustrated, thousands of citizens surrounded the Legislative Council a few days later in an attempt to halt any further discussion about the bill. The conflict escalated and the police responded to the protesting citizens with so-called non-lethal weapons.
琴日咧，全日咧大概用咗超過150枚催淚彈，數發嘅橡膠子彈，同埋大概20發嘅布袋彈。呢個就係我哋目前掌握嘅數字。
That was over 150 rounds of tear gas, several rounds of rubber bullets, more than 20 beanbag rounds, and of course, liberal use of pepper spray. Are these truly non-lethal weapons? And what impacts do they have on the human body? The crowd-controlling tools can be broadly categorized into disabling weapons such as pepper spray and tear gas, and physical agents such as rubber bullets and batons. The objective of the disabling weapons is to rob the protesters of their physical senses, such as eyesight, and usually also inflict physical distress on the victim. Physical agents, on the other hand, physically harm the victim and produce pain and injury, hoping that this might deter the person from continuing the protest. First off, let's talk about pepper spray. The active ingredient in pepper spray is oleoresin capsicum, a plant toxin extract derived from hot chili peppers, hence the name. It's widely believed to be the safest crowd-controlling measures. However, the effect it brought to the victim can be truly terrible. The vapor gets into contact with the skin to give you a burning sensation. Some might even describe it as being set alight. When it gets into your eyes, it can cause serious inflammation, which may cause temporary blindness for up to 15 minutes. Residual scarring of the eye is also reported. The most worrying effect of the spray concerns your breathing. If it gets into your nose, throat, and lungs, it can cause local inflammation and makes it difficult to breathe. It's exceptionally dangerous to those with asthma, those taking other drugs, or those being restrained in awkward positions. They might have difficulty in breathing and eventually die of asphyxia. In 1995, the Los Angeles Times reported that at least 61 deaths are associated with police use of pepper spray since 1990 in the US. If you are unfortunately hit by pepper spray, the best thing to do will be to flush your eyes with water and blink vigorously to encourage tears to flush out the irritant. There's no evidence that baby shampoo or milk or any other liquids work better, so just stick to water. Pepper spray, in fact, is a form of tear gas, but what we are about to discuss will be the form of tear gas fired from a gun and released from a cartridge. The general effects of tear gas is very similar to pepper spray. Another major risk of tear gas comes from the fact that it is released from a cartridge, and when it hits you, it might give you minor injury and bruising, but it can also give you loss of eyesight, skull fracture, and even death. Additional risk may also come if the authorities fail to check the expiration date. A study done in Venezuela showed that expired tear gas might break down into poisonous compounds that are extremely dangerous to the human body. The first thing you should do when the authority fire rounds of tear gas will be to withdraw from the contaminated area. Going to the high ground helps, as the agent is usually heavier than air. Removing contaminated clothing is also important. Again, you should irrigate your eyes with water liberally. Rubber bullets are probably the stable weapons in riot control. These bullets are designed to produce contusions, abrasions, and even hematomas or internal bleeding in the victim in order to stop them from participating in the protests. Back in the days, a lot of different materials are used to design non-lethal cartridges. The Hong Kong police, during the British rule, had actually developed wooden bullets and used it on the citizens. However, wooden bullets splinter unpredictably and may cause severe injury, and thus they are withdrawn from use very early on. Although rubber bullets are designed not to be lethal, innumerable deaths have been reported over the years. In a study done in the UK looking into 90 patients being hit by rubber bullets, 2 eventually died, 18 suffered from permanent disabilities, and 44 more require inpatient hospital treatment. Beanbag rounds may be harder to understand. Essentially, the projectiles fired are akin to beanbags, as they are small fabric pillows filled with lead shots, They are designed not to penetrate the human body and cause minimal long-term trauma. That said, such beanbag rounds can be very deadly. First off, they are fired from actual shotgun and can reach a speed of up to 19 meters per second. They can also easily fracture the skull if hit on the head, fracture the ribs and cause serious abdominal injury when hit at the trunk. Therefore, officers who are trained to fire such rounds are taught explicitly only to fire at the extremities, such as the arms and the legs, and never at the body, and especially not the head. As you can see, most of these so-called non-lethal weapons can and do cause severe injuries and occasionally even death. Some people therefore consider less lethal weapons to be a better term to describe these weapons. Whatever the weapon that they are using, police officers should bear in mind that the weapons can severely injure the person on the receiving end. They should only utilize these weapons in desperate conditions, and should never use them liberally just to control the crowd. What do you think about the recent protests in Hong Kong? Do you think the police has used excessive force in handling the situation? Please let me know down in the comment section.